Hey guys, this is Dr. Samir Islam. I want to thank you for joining me tonight. And so today we will be concluding our series on obesity. And I'm excited to talk about a new innovative procedure that we're doing for weight loss, which is very exciting. It's one of the newer things that we're doing to help out with our patients with obesity. So as a review, in the prior lectures we talked about the problem of weight gain, what contributes to weight gain, why do we get fat, and what can be done. And in the prior lectures we talked about some of the things like lifestyle, diets, and some of the endoscopic procedures for weight loss. And today I'm going to focus on a brand new procedure that only very few select centers are doing in the United States. It's called endoscopic sleeve gastroplexy. It's a very new, innovative way to achieve weight loss, which is similar to a sleeve gastroplexy, but it's minimally invasive, done as an outpatient. Now, like all the other endoscopic procedures for weight loss, all of these are non-invasive or minimally invasive. They're non-surgical. We're not cutting you open. We're not changing the anatomy. But the unfortunate thing is because they're so new, they're not currently covered by any insurance right now. And so the ESG, or endoscopic sleeve gastroplexy, is a new minimally invasive procedure to help you lose the weight that you want to lose. And in essence, what we're doing is that we're reducing the size of the stomach using an endoscopic suturing device. We do it from the inside the stomach, done all as an outpatient, and we sew the stomach smaller to make sure so you don't eat as much as you normally do and you get full quicker than you did before. Now, the benefit about the ESG is that it's for those patients who don't want surgery, so for those who are not looking for a permanent change in their anatomy, or for those patients who don't want to have any alteration of their anatomy, this may be an option for you as well. This is also made for those patients who did not achieve their weight loss goals or their weight loss dreams with either diet or exercise. So you try to do other things like diet or exercise, but it did not work. And also, most importantly, the big difference is that this is also a achievable option for those people who do not want a permanent change to their body. They still want to keep the anatomy that they've been born with. They're just hoping to find another way to help them lose the weight that they want to lose. So when it comes to ESG, what to expect? Basically, it's a fairly innovative procedure for weight loss. It's done as an outpatient in an endoscopy center. We typically do put you to sleep so you will not feel anything or you will not remember anything. And then while you're asleep, we use a very small camera. We go down through the mouth and the esophagus and we go into the stomach. And whenever we're in the stomach, we actually attach a suturing device to the actual scope itself. And once it's down there, we actually do the procedure inside the stomach without making any incisions in your abdomen, so there's no scars that are there. And from the inside the stomach, we're able to place some sutures, approximately 12 sutures in the stomach, and they allow us to help make the stomach smaller and smaller, almost like a tube, which essentially restricts the amount of calories that your body absorbs or intakes. The total time for the procedure can range from 90 minutes to 2 hours, or even up to 3 hours for some people as well. Once we're done, you're awakened in the recovery area where we can monitor you for any complications, and the vast majority of our patients can go home the same day. In fact, it's meant to be an outpatient procedure. We want to try and do this procedure so you can go home that exact same day. Now, I know it may be hard to kind of visualize this, so I have a video here about what actually the procedure entails. But in essence, we go down with the scope, we go down with a very small camera, and we have that suturing device attached to the camera. And while we're inside the stomach, we try to create an area to place the sutures that we use to help close the stomach to make it smaller. So here we're marking the stomach. And then next we place the sutures in the stomach, all done from the inside with the scope. And in most cases, we place 12 sutures inside the stomach. And we basically just close the stomach up like an accordion. And so we change the shape of the stomach from what it is to make it a smaller size, so you don't eat as much as you did before, and you get fuller quicker than you did before. And that's it in a nutshell. Then as an outpatient, can take about 90 minutes in some cases. So after the ESG, typically you won't be allowed to eat for about 8 hours, but then we can start you on a liquid diet, which you continue for at least 2 weeks. And over 4 weeks, you'll move to more semi-solid foods. Then usually by the time we hit 4 weeks, you can hit regular foods and have a normal diet as well. As part of the whole process, you'll meet up with the clinician and with the nutritionist to make sure you're maintaining the weight goals and for us to catch any problems that may occur. Now, in terms of the studies, the ESG has been shown to have pretty significant weight loss, even comparable to the gastric sleeve as well. And so in terms of the weight loss amount, it is pretty equivalent with respect to both the endoscopic sleeve and the surgical sleeve as well. But as anything in life, a lot of it depends on the habits you adopt. And that's why we have you see a nutritionist once a month for a full year to teach you exactly what to eat, how to eat, to hopefully get the results that you need. And it has been shown to improve conditions related to obesity, including things like reflux, heart disease or stroke, high blood pressure, sleep apnea, or even type 2 diabetes. Now, one of the biggest questions is, what is the main difference between the gastric surgeries versus the ESG? And I have the ESG done here. So number one is that the ESG is non-surgical. So we're not changing the anatomy anyway. We're going through the mouth into the esophagus to do our work on the inside. It's a very low or even minimally invasive surgery. It's a very easy procedure to do. Like I mentioned before, it's meant to be done as an outpatient. And that's why you typically do not have to stay within the hospital. There are no scars, so there's no incisions or cutting within the stomach. It's all done from the inside, so you don't have any abdominal scars that are shown. And the stomach is left intact. And so we are not removing the stomach. We're not changing the stomach in any way, shape, or fashion. We're keeping the stomach in there and just making it smaller from the inside. The recovery takes about 3 days. Most people respond very, very quickly to the ESG as well. And one of the good things about the ESG is that for patients who've had it, who failed, we have the option to reverse the suturing, and also you can proceed to other gastric bypass surgeries as well. Some of the other options, including the gastric sleeve, that's not reversible. And if you have the lap band as well, that can be reversible as well, which can lead to other further medical procedures if you want to pursue that way. In terms of long-term data, we do have a lot of long-term data for the other sleeve surgical procedures and the other bypass surgical procedures, but because the ESG is relatively new, we don't have long-term data, though the data currently that we have looks to be very effective for those patients who do undergo the ESG. There's a very low rate of complication, especially because it's minimally invasive, especially when you compare this to the gastric band versus the gastric sleeve as well. And the complications are very minimal as well. Some of the main side effects are pretty small. You'll have some pain and nausea, which will last for a couple of days after the procedure, and it has a very good safety profile. And if for some reason you are not happy with the sleeve or you have significant complications, the benefit about the ESG is that it is completely reversible. So we can certainly remove the sutures if we need to turn the stomach back to what it was before. As part of the ESG program that we have here, we do have you visit once a month with a coach to make sure you're achieving the lifestyle changes that we want, to make sure you're implementing the diet, to give you tips and options about what you can do to help out with your diet and discuss different goals and strategies as well. Now, the same patients who should not do the endoscopic balloon procedure should not do the ESG one. So if you've not tried anything else to help out with weight loss, if you're not committed to the program, this is not going to be the right option for you because you may not lose the weight that you want to lose. Some of the other reasons why you cannot do the ESG, if you've had prior stomach surgery before, the ESG would not be the right option for you. If you have a large hiatal hernia, this would not be the right option for you as well. Or you have to be on blood thinners and cannot stop these for the time when the sutures are in. This would not be the best option for you as well. And the best patients are obviously the opposite of that, those who are committed to a lifestyle of change, who are committed to exercise and the nutrition program as well, who've tried other mechanisms to help you lose the weight that you want to lose but have failed. And so you tried Weight Watchers, you've tried Jenny Craig, you've tried exercise, but you've not been able to maintain that weight loss. And for those patients who are not looking for a surgical option, if you're not looking for a change in your anatomy, this would be a great option for you as well. So so what are the next steps for ESG? So if you are interested in having a consultation, the consultation for me is free with the ESG. Make an appointment. Visit my website, drislamweightloss.com. We have a way to contact us. Call our office as well. We are more than happy to see if we can assist you. We do take out-of-town visits. They're welcomed. If you would rather do a phone consult, we're more than happy to get that taken care of for you as well. If you want more information on this, I will include my free ebook on weight loss, which includes the other options that we have for weight loss, including the ESG. And this may answer some of the questions that you may be wondering as well.